come to talk to the Australian nurses and midwives and other health professionals about why not to privatize in the ways the United States has privatized its healthcare system. There are so many things happening that are difficult for American citizens to get health care. Even under the new health care law that's been passed in the United States, we still will be largely a market-based, for-profit, health insurance-based system. And the problem is just so pervasive. We have about 123 people who die every day in America, 45,000 a year, according to a Harvard University study, because they can't access care, not because the care isn't available, but because they can't afford it, either through a public or private insurance program or through cash or credit. I have a really dear friend, wonderful woman, who tells the story about having developed severe chest pains in the middle of the night one night, was pretty certain that she was having a heart attack. And yet, as she laid there and calculated, she didn't have enough health insurance to cover the cost of what a heart attack would cost, but she did have mortgage insurance. So as she laid there, she thought about, if she was going to die, that at least if she died, her son's mortgage would be paid off and he would have the house. But if she went to the hospital and got the care and had a huge medical bill, then she would put herself and her son in a bad position. She's a single mother. She didn't go. She waited 16 hours, having had a massive heart attack, and waited 16 hours to seek medical care when her son finally demanded that she go. Was found to have serious heart damage and coronary real insufficiency following that. Real damage to her over time. And I often tell people that is not the system Australia needs to follow. You know, there are so many measures of your system that are better than ours. We tie in a couple of areas, but you'd think when we spend more than double what you do every year on people, we spend about $8,000 a year, you spend about $3,400 a year per person on health care. Your measures of health outcomes are better, your compassion for one another is better, and the more you move towards privatization, the more the drive for money drives what happens in your healthcare system. Healthcare providers that are profit-based and privatized, they by law have a responsibility to their shareholders, to the stockholders, not to the patients, not to the people of the country. Their responsibility is legally to their shareholders to make money. It's not to make better health. It's not to make a better system. And the more we can share with each other about these kinds of systems and the damage it's doing to our communities, our nations, and even to our world, the better off we may be in the long run.